Hello, and welcome to HSS Florida. This is Dr. John Patrick Connors. I am a hip and knee replacement surgeon with the Adult Reconstruction and Joint Replacement Service at the Hospital for Special Surgery. We are honored that you have entrusted us with your orthopedic care. Thank you for your time and attention over the next few minutes as we review some important information prior to your hip replacement. Over the next 20 minutes, I will review important information regarding hip replacement surgery, as well as planning and preparing for your operation, the day of your procedure at the Ambulatory Surgery Center in West Palm Beach, as well as what to expect at home after surgery. This video is intended to provide a basic guide to your experience and should not replace direct discussion with your surgeon. The normal hip is a ball and socket joint between the top of your femur bone and your pelvis bone. The cartilage that covers the ends of the bone acts as a cushion to allow your hip to move freely and without pain. Due to a combination of factors, typically related to aging, your particular genetic profile, and potentially prior injury to your hip, the cartilage coverings of your ball and socket can begin to break down prematurely. This leads to inflammation and ultimately the roughened bone ends rubbing against each other. This is what is known as arthritis. Patients typically feel this as pain deep in the groin, buttocks, thigh, lower back, and even the knee, particularly with activity. If after an extended course of conservative treatment, you continue to have symptoms from your arthritic hip, hip replacement is a great option to reduce pain and improve function. Hip replacement is a procedure to remove the diseased arthritic bone ends, replacing them with new metal and plastic parts that act as your new hip joint. A hip replacement is composed of 4 component parts. First, your hip socket is machined to allow for acceptance of a highly porous titanium cup. Bone sees this as self, and the cup becomes incorporated with your pelvis bone. Inside of that snaps a specialized plastic liner that acts as your new cartilage. On the femur, your femur bone is machined to accept the femoral stem, which is a roughened titanium component that is wedged inside of the femur, and the bone again grows in and onto the stem. On top of the stem snaps a ceramic ball that becomes your new hip joint. These parts are selected specifically for you based off your individual size and functional needs. The purpose of a hip replacement is twofold. It is to reduce the pain you are experiencing and get you back doing the things that you love. This is a highly successful operation, with more than 97% of patients undergoing hip replacement at HSS satisfied with their operation. Despite being a highly successful operation, like anything else in life, there is no free lunch, and nothing is without risks. We believe it is important for you to understand these risks before your surgery. Specific to a hip replacement, the most important risks are infection, blood clots, wound healing complications, and dislocation. These all occur at a rate of less than 1%. Later in this video, we will review our specific pre- and post-operative protocols to minimize these risks. We will again review this in detail together at our pre-operative visit. I perform hip replacements through the direct anterior approach. While there are a number of advantages to this technique, including a smaller incision, avoiding cutting muscle, and faster recovery within the first 6 weeks after surgery, most importantly, this allows me to use fluoroscopic navigation during the operation to ensure that you leave the operating room with perfect implant position for your specific anatomy. This affords the best function and lowest risk of dislocation of any hip replacement technique. If hip replacement is something you are interested in proceeding with, there are a number of tasks that you will need to complete before surgery. The first step is to see your medical doctor and any applicable specialists, such as a cardiologist, to determine if you are healthy enough to undergo surgery. They will order routine blood work and an EKG. I also ask that you see the dentist prior to surgery for a clean bill of dental health, as I would request that you do not have any dental work for 3 months after the procedure to minimize the risk of infection. These clearances will need to be sent to our office at least 2 weeks prior to your operation, and I recommend that you call to get in with your primary physician, cardiologist, and dentist as soon as possible once you have picked out a date for surgery. Next, you will need to prepare your team and your home for surgery. Hip replacement recovery is a team sport, and you cannot do this alone. You will need somebody to pick you up and drive you home from surgery, and I ask that you have somebody with you around the clock for at least the first 72 hours after surgery. After that, you may stay on your own, but most patients will need some help around the house with things like cooking and cleaning for at least the first 2 to 3 weeks after surgery. Through your insurance, my team will coordinate a nurse and a therapist that comes to your house twice a week for the first 2 weeks to check on you. These are not full-time caregivers. Most commercial insurances, particularly Medicare, do not cover full-time caregivers or rehab center stays after a hip replacement. It is important you discuss your benefits with your particular insurance carrier to understand what will be covered, what will require a copay, co-insurance, or is an out-of-pocket cost. You will also want to prepare your home for surgery. This includes organizing frequently used items nearby, such as phone chargers, removing anything from the ground that may be a tripping hazard, and making a recovery plan for any pets that you may have at home. Next, there are several pieces of equipment that you will need to gather. In your pre-surgery packet, I have provided you with a prescription for a walker. You will need this for the first few days to a week after surgery. You can obtain these from a local durable medical equipment supplier if you would like to use your insurance, or alternatively, these can be purchased out of pocket from a store like Amazon or Home Depot for approximately $60. In your pre-surgery packet, I have also provided you with specific instructions for skin and nose cleaning prior to surgery. I ask that you obtain these specific items as soon as possible, as you will need to begin using them starting 5 days before your operation. Finally, many patients choose to use additional equipment such as an ice machine, shower chair, or raised toilet seat to help with their recovery. While not typically covered by insurance, I have partnered with a third-party vendor known as the Recovery Shop to help facilitate you obtaining these helpful items prior to your surgery. You have received a QR code in your surgery packet, as well as a direct link that will be included in the email containing this video. Next, I ask that you prepare yourself for surgery, and I believe the importance of this slide cannot be overlooked. I ask that around the time of your operation, you treat yourself like an athlete. If you are smoking, I ask that you stop smoking 6 weeks before and 6 weeks after surgery to minimize the risk of infection. I would ask that you participate in your pre-surgical exercise program, as well as attend your pre-operative physical therapy visits with our HSS physical therapists. Furthermore, I ask that you focus on your diet, eating high-quality, high-protein foods, as well as whole grains and colorful fruits and veggies, as eating a healthy diet has been shown to make a substantial difference in your recovery after surgery. 2 weeks before your operation, you will have a phone call with one of our nurse navigators. They will review your medical clearances, as well as your full medication list, including what medications to stop and when. It is vitally important that you follow their instructions, as failure to do so may result in your surgery being canceled. While these specifics will be reviewed in detail at your 2-week preoperative phone call with the nurse navigators, as a general rule, I ask that you stop anti-inflammatory medications at least 10 days prior to surgery and any blood thinning medications at the very least 5 to 7 days before your surgery, though this will be ultimately at the discretion of the physician who prescribes these medications. Additionally, it is critically important that all medications are listed on your medication list. If you take a biologic drug or chemotherapy that is not found on your medication list, please tell your nurse navigator or call my office to review these medications together. 1 week prior to surgery, we will meet together to review your clearances, your consent form, and answer any last questions that you may have about surgery. I will then send your postoperative medications after this visit. I ask that you fill these as soon as possible so that you have them available for you after your surgery. You will begin your nasal and skin decolonization protocol with your Hibiclens and Nasen beginning 5 days before surgery. This is a protocol called universal decolonization, with the goal being to reduce the amount of potentially infectious bacteria on your skin and in your nares prior to surgery. Please refer to the handout in your pre-surgery folder for detailed instructions. Finally, I ask that you hydrate with a carbohydrate-rich sports drink before your surgery, as this has been shown to improve your recovery from anesthesia as well as surgery itself. This is as simple as a full sugar Gatorade the night before and the morning of surgery at least 2 to 3 hours prior to your surgery start time. It is important that you do not eat anything after midnight the night before your procedure. While you may have black coffee in the morning of surgery at least 2 to 3 hours prior to your surgery start time, please do not put any milk or cream into this. A patient's surgery is canceled at least once a month over coffee creamer. Please do not let this happen to you. The day of surgery is an exciting and nerve-wracking time for patients and caregivers alike. It is quite normal to be both excited and nervous the night before and the morning of your surgery. Your surgery will be performed at the HSS Ambulatory Surgical Center in West Palm Beach. The facility is located on the 4th floor of our main office building at the 300 Palm Beach Lakes Boulevard location. You will enter on the 1st floor, check in, and will be directed to the patient elevator that will take you up to the 4th floor. Included on this slide is a QR code linking directly to Google Maps from your current location. You may want to use this the night before surgery, so you have directions planned ahead of time. It is important that you arrive on or before your scheduled arrival time. Once you have checked in on the 4th floor, your caregiver will wait in the waiting room while you are brought back to the preoperative area. Here you will change into a surgical gown and have an intravenous line placed for medications. I will see you before the operation for last-minute paperwork, and you will meet with our wonderful anesthesia team to review your individualized plan for anesthesia. This typically includes a spinal anesthetic and light sedation, which minimizes the amount of general anesthesia that you need. When it is time for surgery, you will be brought back to the operating room. There are lots of people and lots of activity going on, but all is focused on helping you. After your anesthetic medications are given, you will be positioned on an operating room table specifically designed for hip replacement surgery. The surgery itself takes me about 45 minutes to an hour. From the time you enter the room to the time you return to the recovery room typically takes about 2 hours. In the recovery room, your nurse will monitor you as you wake from anesthesia. Once you are able to, he or she will teach you how to walk with your walker and get you in and out of bed. Once you are comfortable, you'll be discharged home. This is on average about 4 to 5 hours after arrival to the surgery center. After discharge, while the hardest part is over, the first few days of recovery can certainly be challenging. Over the next few slides, we will review your experience at home to make your recovery as easy and seamless as possible. At home, I want you to take it easy for the first 2 weeks. I expect pain, swelling, and bruising, particularly worse on days 2, 3, and 4. Icing and elevating as much as you can help keep the swelling down. Take your activities slow for the first 2 weeks and follow the instructions of your home therapist. I find patients who overdo it in the first 2 weeks actually tend to slow their recovery down due to their increased swelling. I expect you to have some pain after your operation. Ice, elevation, and relaxation are all excellent ways to help with the pain over the first few days. You will have a number of different pain medications prescribed for you, and I expect that you will need them for at least the first few days after surgery. Ice and elevation are highly important and often underutilized means of controlling pain and swelling after surgery. In the first 2 weeks, there is no amount of icing or elevating that I would consider too much. When you are elevating, it is important that you elevate your operative limb higher than the level of your heart. This means putting your toes above your nose. If you notice swelling in your knee, ankle, or foot, You are not elevating enough. Nausea can be quite common in the first few days after surgery. Please follow these tips, particularly eating small, dry, bland meals for the first several days. Included are a list of foods that can help with nausea, including dry toast, crackers, pretzels, or applesauce. Constipation can also be quite common following a hip replacement, particularly when you are taking narcotic pain medications. It is important to make sure that you are drinking enough water, and make sure you take your stool softeners to prevent constipation while you are on narcotics. If you are having a hard time going, over-the-counter Miralax, prune juice, or simply black coffee can be good options to help you go. A deep vein thrombosis, or DVT, is a rare but potentially dangerous complication after orthopedic surgery, particularly after hip and knee replacement. You will be prescribed DVT prophylaxis medication prior to your surgery. This will be based off your individualized risk profile for clotting. It is important that you inform our office of any personal or family history of blood clots, hormone replacement therapy use, or active cancers prior to your surgery, as these can all increase your risk for blood clots. It is vital that you understand how and when to take your DVT prophylaxis medications, and you should not be discharged home until you understand this. At home, I ask that you take frequent short walks and perform your ankle pumps when icing and elevating to improve your circulation. Please do not hesitate to call our office if you have concern for a blood clot. Next, regarding your dressing. Your surgical dressing is waterproof, and you may begin showering with this right away. It is important that your dressing stays clean and dry. If this becomes soiled or wet, you may change it. If your belly hangs over the edge of your incision, particularly common with an anterior hip replacement, it is important that you keep that area in the skin fold clean and dry. Please use a clean and dry hand towel to keep this area dry. You will remove your waterproof dressing on day 7, and you will leave the silk bandage on underneath in place. This bandage will stay on until it falls off on its own. This is typically around 3 to 4 weeks. You may leave this bandage open to air, and you may shower over this. Finally, if you have any questions or concerns after your operation, please do not hesitate to call our office. There will be lots of people checking in on you after surgery, including the home health nurse and myself the day after surgery, as well as your nurse navigator in the following days. Please do not hesitate to reach out to us if there are any questions or issues. Thank you again for your time and attention. I look forward to providing you with the highest quality orthopedic care. Please do not hesitate to reach out to my office with any questions or concerns regarding your hip replacement, and I will see you at your 1-week preoperative visit. Thank you.